So today I'll be talking about a 3.3.4 physical and occupational therapy, the rehabilitation plan for Mike Smith. So first, I'm going to talk about a physical therapist. So first, you need an education of a doctoral or any professional degree, and a few professional courses are recommended. So their duties are consulting with patients, learn about their physical conditions and symptoms. Another one is diagnose their movement dysfunction and developing a treatment plan. So usual salary for a physical therapist is around $87,930. So occupational therapists. So their education is usually a master's degree. They should have taken any physical, biological, behavioral science courses. And a few courses on occupational therapy or theory and practice are recommended. So a duties that an occupational therapist does is they treat disabled, ill, or injured patients. They help patients improve, regain, and develop the skills needed to a day-to-day life. And their salary is around $84,270. Now I'm going to start out talking about Mike's cases so the family understands what's going on. So to start out, Mike Smith is a 17-year-old that has been diagnosed with osteosarcoma. So despite chemotherapy, radiation therapy, and oncologists informed him that he needs to have his arm amputated. So due to some overwhelming emotions, he needs psychological counseling, palliative care, a prosthetic arm, physical therapy, and occupational therapy. So the main goals for the rehabilitation plan. So goal 1 is the ability to overcome main struggles of disability and master daily activities in life. The goal 2 is to help him adjust from physical and mental changes. And goal 3 is for patient independence and a well mindset. So physical needs of patient Mike Smith. So first, he'll be needing a prosthetic arm. The prosthetic arm will help make his daily activities easier, and so he can better undress, dress, eat, and learn to tie his shoes. So he is now in need of some more physical activities to get back in shape and learn how to use his arm and have better control. So his physical needs. Mike will need to learn to adapt with prosthetic arms. So dressing and undressing will be hard for him because, especially with one arm, he needs to know how to adapt that way since he's probably not used to that. So for his education, Mike will be dealing with feelings of standing out and struggles completing his homework and writing different tests. And for eating, Mike will need some assistance, especially in the beginning, to eat now using his left hand, especially using utensils. And then for sports, Mike needs to learn how to replay a sport that he prefers and work around it using a prosthetic arm. So the first month, Mike will try to get comfortable with his prosthetic arm and face few challenges overcoming pain. So specifically phantom pain, which is a sense of feeling in one's amputated limb. It may lead to emotional concerns or overwhelming feelings. So Mike's physical therapist will need to examine him and see progression at his ability to move. The physical therapist may aid him in reducing the phantom pain. The physical therapist can also recommend counseling and support groups to help him get through this time. So the second and third month of Mike's rehabilitation consists of him exercising his elbow. This will help him regain the ability to use his arms better for daily activities. Mike will still experience some pain, though he will slowly adapt to his arm and maybe get more at ease. He'll be able to bend his elbow, allowing him to dress and undress better. So the physical therapist in the second and third month. Mike's physical therapist will show him several exercises he can use to help bend his elbow. The exercises may include stretching his elbow in new ways, flexing his arm, and yoga. This may even help. So the fourth and fifth month. The fourth and fifth month will include exercise in his lower arm to his wrist. Mike will learn how to handle his pain better that he is experiencing. Mike's physical therapist will demonstrate new exercises for him as bending and rotating it. Mike will continually go into his occupational therapist. The occupational therapist may help him learn to write. Though he knew how to write previously, his penmanship will likely have greatly changed. The occupational therapist can make him sort of write better by using a bigger tool, such as a marker or a chalk, and write on a bigger board. The occupational therapist also is thinking of having him write how his daily day went and how he can improve. This will help his mind clear and get more steady on what's going on, what's happening, how to grasp what's happening in his life. So the 6th month. 6th month is the final month of Mike's rehabilitation plan, and he'll mainly focus on utilizing the prosthetic arm and using it to its full capacity. So the physical therapist will see if how to move his arm in general and how his progress with daily activities has been going. The occupational therapist will also assess his ability and see if he can write properly. Mike will likely have come a long way, still has a long way to go, but he's still off to a great start and made great progression over his first 6 months. A typical physical therapy session. So Mike and his physical therapist will work on different exercises where he will need to extend, stretch, and flex his arm. A few sample exercises are flexing and yoga. These muscles are targeted on the triceps and biceps. A typical occupational therapy session. So Mike and his occupational therapist will work on exercises involving his fingers and his wrists. Sample exercises include stretching and riding on a board. Muscles targeted in this exercise are the brachioradialis and extensor muscles. So other biomedical science professionals involved in Mike's case will be a biomedical engineer. So they'll be the ones developing the well-working prosthetic arm for him to use during the 6 months and after the rest of his life. A specialist nurse also may help as they work closely with the surgeons and help him with the limb fitting. So a few recommendations. Mr. Smith should keep seeing his oncologist to make sure the cancer does not reappear. So meet the healthcare team that's working with Mike. So our surgeon is John Stamos, our specialist nurse is Chris Pine, and our biomedical engineer is Chris Evans. So our first consultant will be working with Chris Pine is Tom Holland, the prosthetist is Ian Sommerhalder, and the physiotherapist is Victor Grosjean. So the occupational therapist working with Chris Evans is Matt LeBlanc, and the physical therapist is Michael B. Jordan. So these are a few sources that we've looked at to help gain research on Mike's case. Thank you. Have a great day.